Hi, everyone. Thank you for joining the live event today. I'm Dr. Maria Sampoulos. I have the pleasure of having Christos Papageorgiou with us today from Greece. Thank you, Christos, for joining us today.
Thank you, Maria, for inviting me.
Yeah, we're friends, fellow Greek. So it was great to have you on today and just give doctors some perspective of what's going on in the UK, what's going on in optometry in Greece. I think that was great to have you on. Today, I want to give you some background. Christos graduated in 2005 from the Optics Technology Educational Institute in Athens, and also, first class degree from City University London in 2009 for an optometrist, and he wrote the manual for contact lenses in Greece. So welcome, and you're on a lot of different boards, so you're very involved in the industry there.
Yes, we're trying to contribute as much as we can. We have talked about it in the past. Optometry is a profession, but also on my side, it's family history, and it's also something I'm passionate about, and always trying our best to give something back.
Just to get some insight for the listeners, what educational requirements are for optometrists in the UK and to practice in Greece as well?
So in the UK, you have you need to complete a 4-year education. That is the mainstream is 3 years in the university, and then you do what they call a pre-registration year. And you take some exams and you register with the General Optical Council, which is a regulator in the UK. In Greece, a lot of things are changing, and there have been in the last decade a lot of changes. The current situation is that you need to study 4 years at the university as well. A recent change is that the school was renamed and grouped with some others. It's now called School of Biomedical Sciences, and after you do 3 semesters, then you pick a direction, and one of the departments is optics and optometry. And this is how you become, the title you get in Greece is optician/optometrist. So it is an evolving profession. Yeah.
Oh, great. What is the scope of practice in the UK and Greece? Like, what can optometrists do? I mean, I know here we do a lot more, but curious to see what it is in Europe.
Yeah. We should take as a reference the World Council of Optometry competency framework. They have 4 stages, one being an optician doing just dispensing, the second one being an optician who also is refracting and could also detect some disease, the third one being an optician who also does refract but also detects and manages disease. This has 2 subgroups. It can either be with diagnostic drugs or without, and then you have the fourth one, which is what you are familiar with when you're able to use unprescribed medication and also do some procedures, as is common in the US. Now, in the UK, they are on the 4th of those categories. So when you qualify from the university, of course, you can do primary care and detect. You can prescribe some medication or antihistamines for, and other antibiotics for red eye, but there are this is limited, but you can expand it a lot with additional qualifications. There are 3 levels. The first is called additional supply, and then the second is called supplementary prescribing, and the final one is called independent prescribing. that is how you can expand your scope in the UK. In Greece, we are on the second of those steps mentioned. The profession was opticians before, then it expanded to contact lens fitting, and now the standard of practice is many opticians are also able to refract. For the last decade or so, the school is qualifying people as opticians optometrists, but there is it's not fully synchronized with the legal framework, so many times the school is a little bit ahead before things are also expanded in the professional rights part.
Question for you. Is the exam broken up into two parts? Like if someone just wants to come in for just a refraction just to get glasses, is that legal in the US, I mean in the UK and in Greece? Because in the US, they have to have a full comprehensive eye exam. They can't just come in just for a script. Is that what's going on in the UK and Greece? They're separated?
Well, in the it's different for each country. So in the UK, you have to have a prescription, which prescription has an expiry date. Same being for contact lenses as well. The vast majority of primary care is done by optometrists there, of course. And the demographics between optometrists and ophthalmologists is such that there are very few, and the ophthalmologists, and they are most of them are in hospital eye service. Now in Greece, because the demographics are very different, we have a lot of doctors. Actually, we have the highest percentage of ophthalmologists per population in Europe. To give you some numbers to better understand it, is in the UK, it's 0.22 ophthalmologists per 10,000 people, while in Greece is 2.8. So this is about 10 times more. So they do in Greece, they do provide the most of primary care as well, still. But there is no need, although prescriptions are issued, it's not in law. The law does not mention that this is mandatory to have. So you can copy your previous glasses, for example.
Okay, yeah, but if a patient if a patient's diabetic and they just say, "Hey, I don't even want to check my retina. Can you just give me a script?" They can that's okay in Greece, correct?
Well, in the advice we give at the Hellenic Academy of Optometry is, of course, the two parts have to are connected, both the health check and the refraction, and whether someone provides refraction, they have to refer to another provider to complete the examination, or they have to inform the patient. And now the legal framework is that in Greece, the scope of practice changed a few years ago, that they allowed optometrists to do a number of exams and use diagnostic drugs, but there's a big but there. All had to be done under the supervision of an ophthalmologist. So that was a big shock for us, and this, of course, challenged the independence of the profession. This is something we took very seriously, and there was legal action taken against this decision from the Ministry of Health, and it was last month that the hearing took place, and we expect in the next 6 to 12 months this to clarify. What we are challenging, of course, is the supervisory part of one profession over the other, and we'll see how that goes. Hopefully, it will be able to clarify next time we speak.
Yeah, I mean, if I could be of any help, and we start a petition, we use my network to kind of help optometry all over the world, I'm happy to do that. So we've done that in the past. What is the percentage of private practice versus corporate practice in the two countries?
Well, the two images are very different. In the UK, some statistics a couple of years back. About 80% was corporate, and independents were about 20% and falling. There are big differences. The major player by far is a company called Specsavers. They have about 40% market share, and some others follow at much lower percentages. In Greece, the situation is almost reversed. So still, the vast majority are independent practices. So I would say about 80% is independent and about 20% is corporate. There are no major players there still, because the best way to put it is that the market is fragmented, and there are a lot of small to medium sized players.
Yeah. Question: the ones that do work in the corporate setting, what does that look like? Here in the U.S., we have independent contractor, we have employed, we have sublease, we have franchise. Are they renting space next to it? Are they employed? I know Specsavers is a franchise model. Is that the same model in the UK?
Yeah. Well, in the UK, as you said, it's Specsavers is a franchise model. And interestingly enough, at least a few years ago when I was there, I do remember also Boots, although they had a different model. They were converting a lot of their practices to franchisee because they saw that this was much more effective. In Greece, the corporate are basically any company can have the practices as well, as long as they employ qualified people, and most of them are employed, the vast majority. There are very few examples of franchisee models in Greece, but these are at the very, very beginning, I guess, because it's a primarily independent market still. There's not a lot of need at this stage.
Yeah. What can be done to make optometry stronger overseas? I know here we have different laws, different rules, and compared to overseas. What can we do in the U.S. to help doctors in Greece and doctors in the UK?
Like most things in life, communication is key. It's very important, and communication is a two-way street. It's very important to, every time we read in the news about a law changing in a state in the US, this is something which puts a smile on our face, and we are more connected than we think, all of us. Now, things being done in Europe on a European level, there are two organizations. One is called the European Council of Optics, Optometry and Optics, and the other one is called the European Academy. These are, let's say, sister organizations. The European Academy has more to do with continuous education and clinical excellence, and the Council has more to do with the lobbying part and the commercial aspects also. Similarly, this is something that we also try to do in Greece. The Hellenic Academy of Optometry, of which I'm also a member, came a few years back to fulfill the need for a more clinical perspective, because as we said earlier, the profession is evolving, and it was in my father's generation a technical profession. It was more of a craft and more commercial, and now gradually from the introduction of contact lenses and gradually converting to optometry, it becomes more and more clinical. So we try to promote continuous education. We try to raise the standards. I know that the European Council, they have the European Diploma in Optics and Optometry, which is an effort to harmonize optometry throughout European countries. This is a more complicated task than initially thought, because each country has very different social and economic factors to consider. They are not as homogeneous as the US. If there are differences in states in the US, imagine the differences that exist between European countries. But this is an ongoing battle. We are in the front line, and as I said, communication is the key.
Yeah, I think it's important. I mean, because we lobby together for now, scope of practice is huge. I mean, there's some states that lag behind here in the US with glaucoma, orals, things like that. But now we're kind of all together on it. We all work together to pass those laws. And also now is an injection. So what we're passing here, we can also work together. And I think the World Council organization, is that optometry organization? Isn't that correct too? That kind of brings optometry all together. Am I correct?
Mm-hmm. Yeah, that's correct. That's correct. On our side, locally here, as I am now practicing in Greece, is we are trying to communicate, considering that education is state funded, so the state plays a very big role in the decision making, and that is also through the provisions they have through healthcare, which also affects us. We try to communicate to them that optometry is cost effective for the state. It's a lot quicker and a lot less expensive to train an optometrist compared to an ophthalmologist. And from my experiences in working in the UK, the two can work very well together. And on my side, I cannot see one without the other. Hopefully, this will be, if we manage to pass the message, then this will be much better for both the system, lowering costs, increasing accessibility, and overall care.
Of course, yeah. One more thing. I mean, you published the contact lens manual. Can you just give us some insight? Are there protocols for doctors, optometrists in Greece to follow? I mean, are you setting new legislation with this manual? Give us a little bit of insight on that.
In contact lenses, there are some requirements. For example, a few years ago, the list of equipment required was updated. What someone who fits contact lenses needs to have in their test room. Another thing, which is an ongoing change, which has to do with the organizing structure. There was the state is passed a law recently trying to creating a new organization in which all professionals will be compulsory members. This will have many aspects, as renewing the licenses, possibly starting a compulsory continuous education. Of course, it will include other stuff like disciplinary committees and registries, which are currently kept locally. So this will now go on a national level. We believe to be more efficient. So there's a lot of, as we mentioned in the beginning, it's evolving and on many fronts, and we are there to help wherever we can, and advise also the state where and when we can, as far as our voice reaches.
Yeah, I mean, it's super important that we all work together. Optometry is global. Like you said, communication is important. I think now more than ever with social media, we can connect with each other, see what's going on. I mean, it's very easy for us to sign petitions, to help each other, even donate some money to some of these causes too. Because, some optometrists will say, hey, we're in the US and, what do I care what's going on in Europe? well, a lot of companies that make decisions in the U.S. are based in Europe, so and they'll come over and expand. So I think that's important. I think we all need to be involved with our profession. It is a legislative profession, evolving profession, like you say, and we all need to kind of work together. So I think optometry is a great profession. I think it's something that we can, we have a good lifestyle from it. We help patients. It's something that I'm passionate about, but I think we need to kind of have a bigger approach and think of it globally than just, U.S. or state level. So I want to thank you so much, Christos, for coming on with us today. If there's anything that I can do within my network, always feel free to reach out to me. And that way we can push optometry forward.
Of course. Thank you again for inviting me.